I'm pleased to be joined today on Health Beat by Dr. Lynnea Stines, an obstetrician gynecologist with Faith Regional Physician Services OBGYN in Norfolk. And today we're going to be talking about a common pregnancy symptom, nausea. So Dr. Stines, tell us a little bit more about some interventions that may help with this.
Well, thanks so much for having me today, Rob.
Sure.
Nausea and vomiting in pregnancy is so common. Up to 80% of women will have some kind of nausea or vomiting in their pregnancy. The amount of nausea and vomiting that a woman might have while they're pregnant can vary greatly. Some women will say they have some nausea and vomiting but won't want any interventions or medical treatment for it. Other women will have such severe symptoms that we actually do hospitalize them for it. There are some risk factors that we know put women at increased risk for severe nausea and vomiting in pregnancy. One of the risk factors would be is if women have nausea or vomiting when they take birth control pills, they'll be at an increased risk of severe nausea or vomiting with pregnancy. And also, if a patient's own mother or sister had really bad nausea or vomiting with their pregnancy, they can have, they'll be at an increased risk for severe nausea and vomiting as well. So even with all of that being said, there are some things we can do to help women with their nausea and vomiting. The first thing that we recommend is that all women take a prenatal vitamin starting at least 1 month before they're going to try to conceive. We think this helps because it just helps optimize a woman's health prior to getting pregnant. Once a woman is pregnant, we recommend that they can use ginger at home, eating small frequent meals every 1 to 2 hours to make sure their stomach isn't too full or isn't too empty. Eating bland, dry foods can help. High protein foods can help. Sometimes avoiding fatty or spicy foods can help. So if a woman tries all these things at home and they're still struggling with nausea and vomiting, then we have medications we can turn to. And we have many different medications that we can try to help to best control their symptoms. And like I said earlier, if the medications still don't work at home, sometimes we do have to hospitalize patients for a couple days to get their symptoms under control. So in short, Rob, the best thing you can do is just keep an open conversation with your obstetrician to just get your symptoms as best controlled as they can be to help with their healthy pregnancy.
That's terrific information for us. Thank you so much for being here. To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.